Hi, I'm Dr. Emily Forehand, and I work at Columbia Pike Animal Hospital and Emergency Center, and today we'll be talking about spaying and neutering your dog. So it's important to spay and neuter your dog for many different reasons. One of the biggest things is if we keep a pet intact, so we keep their reproductive organs inside their body. Long term, it can cause cancer. So in the female, it can cause cancer in their ovaries. It can also cause an infection in their uterus that can be life-threatening, called a pyometra. In males, it can also cause testicular cancer and issues with the prostate long term. In terms of behavior, that's a good one as well. So intact animals, we can sometimes see wander off, still intact, they're looking for a mate. So they could run off, get hit by a car, they could run away, they could, have puppies with another pet, whatever it be, and we want to control that. So that's another positive thing about spaying and neutering. The conversation can be started when you first bring in your pet for their puppy exams. Typically, spaying and neutering doesn't happen until about 6 to 12 months of age. It depends on how big the dog is. So larger dogs are usually spayed and neutered a little bit later in life, towards that 12-month period, whereas smaller dogs are spayed and neutered closer to the 6 to 7 month period. You should consult your veterinarian and they'll help you make a plan for what's best for your pet. After the procedure, they will need a recovery time, typically about 14 days, maybe a little bit longer, depending on how the incision looks, how they're feeling. But typically we send home some pain control to help with their pain. We need to restrict their activity so they can't be jumping on and off of furniture. We should avoid picking them up. We should restrict their activity so they aren't running around, like going to dog parks, going on long walks, stuff like that. They need to wear a cone and e-collar so they don't lick at their incisions, they don't chew open the incision. And so typically that would be about, like I said, 14 days. An incision has come open or it looks infected, so it's either bleeding a little bit, there's some like oozing from the incision. In spays, we can sometimes see what's called a seroma, so some of the fluid from the abdominal cavity can build up under the incision. It can be like a bump, so it looks concerning and it can be painful. That's something to look out for. In males, sometimes we can see hematomas, and that can be really painful, where they have some blood buildup in their scrotum actually, and it looks like they hadn't been neutered, and that can be confusing to pet owners. So that can also be pretty painful, but these things are managed with pain control, a little more sedated at home so they don't have the urge to run and jump, and antibiotics as well can help. Thank you for watching. If you have any questions or concerns about your pet's spay or neuter, please give us a call.